The Partnership for Eradication of Cancer in Africa, PECA, in partnership with the National Orientation Agency, have commenced training of NOA staff on advocacy, information and communication and strategic planning for cervical cancer prevention and control in Nigeria. The Director General, National Orientation Agency, Garba Abari, said more advocacy and awareness is needed for preventing and controlling the occurrence of this disease. And Benedict Uko has more.
Cervical cancer is the fourth most common cancer in women. According to a WHO report, an estimated 570,000 women were diagnosed with cervical cancer worldwide, and about 311,000 women died from the disease. The WHO has set a 2030 target for cervical cancer eradication in the world. In complementing the efforts of the Nigerian government, the Partnership for Eradication of Cancer in Africa has commenced capacity building of National Orientation Agency staff on early detection, care and advocacy on eradication of cervical cancer in Nigeria. At the opening ceremony of Train the Trainers today in Abuja, the Director General NOA, represented by Director Human Resources Management, Ogun Kaude Kehinde, revealed the agency's plan for continued advocacy and spoke about the progress against health-related issues as well as cervical cancer.
Before now, people believe cancer kills, but from what they teach us now, is preventable, and we must get it to the grassroots. This is train the trainer process. This group will go down to the grassroots and train those people, those who are the grassroots. We speak all language, like I said, and this group will cascade this training down to the grassroots. We have offices in all the local governments. We have offices in all the states in all the federation. The next stage will be to the states, after that to the local governments. Any NOA staff, anywhere they are mobilizers, and they are ready to enlighten people on. We have more than 4,000 staff nationwide, and we are ready to go to the field at any time.
Also speaking during the training, the Chief Executive Officer, Partnership for Eradication of Cancer in Africa, Salome Eferemo, spoke about her organization's advocacy and involvement in cancer control as she called for more government action.
Healthcare generally in Nigeria is not the best, but I know that cancer has little. Most people don't understand what they should be doing if they had cancer or what cancer is. We're hoping that more people will know about it, and government will escalate its efforts to be able to meet all their commitments to international organizations like the WHO to be able to eradicate and come back to cervical cancer again by 2030, because that's the one that's been scientifically proven that it can be prevented. Cervical cancer and all cancers related to the HPV virus. Apart from cervical cancer, there are other cancers that are related to the HPV virus. Mouth cancers, oral sex, brings that. Mouth cancers, throat cancer, and all other kinds of cancers. So that's what we're advocating for.
The level of advocacy, especially in the rural areas, is seen to be inadequate. The Deputy Director of Public Enlightenment NOA, Theresa Maduokwe, says that the training will lead to more advocacy in rural areas.
After this set of people, about 50 participants today, apart from the officials of other people, other supporting staff, have been trained. The next level would be cascading it to the state level activity, that is state level training, which will involve what we call COMOs, Community Orientation and Mass Mobilization Officers. These people are actually the foot soldiers of this agency. They are the ones who are constantly in touch with the grassroots of Nigeria. Cancer is a thing that does not respect anybody. We all need to know what is right. Right information, right decisions, and timely one at that.
Experts say effective primary and secondary prevention approaches will aid in the eradication of the disease as more advocacy is created.